All right, so moving on to the extremities, you're going to check the patient's hand for any signs and symptoms of malnutrition. The easiest way to do this is to look at the area between the forefinger and the thumb. This area is going to indicate the status of malnutrition. So if there's dipping in this area, a hollowing in this area, that's going to be considered severely malnourished. If you have the patient put their forefinger and thumb together as such, you will be able to see any dipping or hollowing in this area. If you see a slight hollowing in this area, it's going to be considered a mild to moderate malnutrition. If the muscle bulges or is flat but well defined within this area, the patient is going to be considered well nourished. Looking at the patellar region of the body, you're going to have the patient, if they're sitting in a chair as such, have them have their leg in an angle such as this. If they are laying in a bed, you're going to have them put their leg up into such a position. For this, you're going to be looking at the subcutaneous fat and muscle mass within the knee region, the patellar region here. You're going to look for any visible signs of bony protrusions or lack of muscle definition. So if you see a lot of bone protruding and you see very little muscle mass or subcutaneous fat, that will be considered severely malnourished. Within this region, if you feel a slight dipping or a slight hollowing within the knee region, the patellar area here, it'll be considered mild to moderate. If there is well-defined muscle mass and abundance of subcutaneous fat, that's well nourished at that point. Looking at the anterior thigh region, you're going to have the patient extend their foot or prop it up in a seated position. So you will be looking along the thigh here for any depressions or obviously underdefined muscle mass. That would be considered severely malnourished at that point. If there is a mild depression or on the inner thigh, that could be considered mild to moderate malnutrition. And if the thigh is well-rounded and well-defined with muscle mass, then they will be considered well-nourished as a patient. Looking at the anterior portion of the calf, you're going to have the patient extend their leg as such as you either hold their ankle or have it propped on a piece of furniture. You're going to ask the patient to flex and point their toes in such a way so that way you engage that muscle along the back of their leg. Palpate along the calf to feel how well defined the muscle is. If it is underdeveloped in any way, it's going to be considered severe malnutrition. If the muscle shows signs as not being as well developed, it could be mild to moderate malnutrition. Feeling along the muscle, if it feels well defined, well developed, then it will be considered a well-nourished patient. Looking at edema along the patient, edema appears in various sections of the body. For a patient who is bedbound and not as active, you're going to want to check the scrotum and the vulva to see for signs of edema. Excess fluid buildup is going to deposit in areas of soft tissues. For a person who is a little more active, gets out of bed a bit, you're going to want to check their ankles for any pitting edema. At that point, you're going to judge the amount of pitting. If the patient has 3 to 4 plus pitting for 30 to 60 seconds, it's going to be considered severe malnutrition. If the patient has 1 to 2 plus pitting for 0 to 30 seconds, they will be considered moderately or mildly malnourished. If there's no signs or symptoms of any swelling, any pitting, any excess fluid accumulation, they will be considered well nourished. Done the assessment and you have discussed with the patient the outcomes of the assessment, you will be able to exit. Make sure to thank your patient for the time and the cooperation during the assessment, and remind them that there will potentially be any future follow-ups, 1 to 2 days, depending on what your protocols are. Always ask the patient if they have any questions regarding their assessment or their nutritional status. This would be a great opportunity to let the patient know what your contact information is, so that way they can get a hold of you if they have any further questions. And exiting the room, make sure that you remove any gloves, gowns, masks that are necessary and dispose of them in the proper containers as you are exiting the room. Thank you.